Hey, chaplains. My name is Kurt Hodges. I'm the oncology chaplain at University of Louisville Hospital and the James Graham Brown Cancer Center in Louisville, Kentucky. I do inpatient and outpatient spiritual care. I'm making this video because I've been working with developing telehealth options for spiritual care very quickly since COVID came into our lives, and I've seen a few questions on this Chaplaincy Innovation Labs group page that are questions I might be able to help with some of the things that I've already been exploring, or things that are working well here and might work where you are too. I would not be sharing this video under the other circumstances because a lot of what I'm about to share is not yet tested. But given the nature of what we're dealing with right now, I think trying to share ideas with each other and share what's working so far is a good thing. So one of the big questions that I'm seeing right now in various places about how we can reach out with spiritual care via telehealth is about HIPAA and about platforms. I saw someone else already answered the question about HIPAA going through temporary changes because of COVID. As far as platform goes, I don't have a choice here in my hospital system. I'm using BlueJeans. The reason for that is that we were already trying to go toward telehealth and outpatient care. And since that's one of the areas that I work in with oncology, I was already trying, before COVID, trying to get some initial baby steps in how I can be a part of that movement too, so that I can overcome the barrier to care. A lot of my patients are lower income. A lot of them, for various reasons, income or otherwise, are pretty isolated. Urban and rural. So telehealth is an opportunity to reach out to them anyway, but now under these circumstances, it's been especially a big deal. If it was up to me completely on what platform I'd be using, I might be using Zoom instead. A couple of the reasons that I'm especially interested in that is that Zoom and BlueJeans both offer a breakout room option, and I'll come back to why I think that can have some good applications for us in chaplaincy. But in any case, let's see. So outpatient applications, I saw a couple of questions in this group already in the last day or two about support groups and bereavement groups. I think that BlueJeans and Zoom offer great options for that because, well, for one, the breakout room factor is pretty huge. So I don't have to worry so much about registrations and advanced planning, given how emergent everything is with COVID. If we put it out there, let's say I put a post on my hospital's social media site, hey, we're gonna have a support group tomorrow or today or whenever, and just put the link out there. If we're prepared, let's say that we have a chaplain and a social worker or a couple of chaplains or whomever set up as co-hosts on different computers, then if we have a small group respond, great, we're ready to go, and we can facilitate something rich and really focus on that key component of interactivity. Whereas if we have a lot of people show up, too many to have a single intimate conversation for a support group, then that breakout room feature offers us the option that, let's say, one of the hosts, facilitators, takes half the group and the other one takes half the group, and we're in separate video rooms. We can choose to come back to the main room at the end of the session to do like a closing ritual or another goodbye to everyone, or not. So I like that feature, and I'm excited about where that can go. Again, I haven't done much testing with that yet, but it's an option that's out there, and we're exploring here how we can use that option. The other thing that those give us is the opportunity to screen share, and I'm pretty sure on both of those platforms with BlueJeans and Zoom that you can screen share audio and video. So if we wanted to share a song, if we wanted to share whatever as a way to open or close a space, as something to interact with our people that we're caring for, we have that option. So I also want to talk about inpatient applications that we're exploring right now. Like so many of you, we're in unprecedented territory of what it means to have this new category of isolation patients, and both COVID patients, rule out patients, and potentially others. So what I'm trying to do right now is work on a rollout, again, untested right now. Hopefully that'll change in the coming days, that we can get this going. But Looking at ways that with isolation patients where chaplains might not be among those staff considered essential enough to be permitted into the room, or it's even advisable for our own health and safety to go into that room, that we can provide telehealth in-house. So what Blue Jeans does, and the reason that my hospital system was already going there, is it assigns a unique number, or the administrator of the group assigns a unique number to that patient. And then that sort of creates a virtual chat room, so to speak, that exists as long as you want to keep it in existence, that you and that patient can meet, or that as many people that you invite to that room can meet. So if I want to give that number to the patient, great. If I want to give that number to the patient's family, great. If I want to create a support group in an inpatient setting, great. We can do all that there. As far as anticipating what those needs might look like, we're also looking at how currently any patient that we have on isolation precautions is not a patient that we can care for because they're intubated or otherwise not responsive. So in those cases, the same application, the new hurdle is what does it look like when family members are not permitted in the room, but then all the waiting rooms are locked and closed, so there's no reason for them to be in the hospital, and now they're outside of the hospital, their loved one is very sick, and we're not here to support them and care for them the way that we would under other circumstances. So I think that these platforms are giving us an opportunity to be able to reach out in those settings as well. What we're looking at is how we can reach out with a phone call initially to reach out to the family, let them know that we're here, let them know that we're available to schedule a telehealth visit, give them that unique number that's assigned to their loved one who's the patient, and then have that available for them. As I'm exploring other ideas of where this could go from there, also looking at the possibility of how can this be a way to support end-of-life care if we're in situations where family are not permitted in the room even at end of life because we're that concerned about spreading the virus. Then perhaps we can have one camera in the room, one camera with the family, and one camera with the chaplain in 3 different locations, but trying to be there to support one another for that kind of end of life care and life review and whatever else might be most appropriate. In terms of how we can adjust that, I think that even that breakout room idea could be something that could help. For example, if we want to talk to the family separate from the patient, just the same way that we might be stepping outside of the room or into a private family waiting room or something with the family at different times when we're not at bedside with them, then I think that Blue Jeans and Zoom can offer those options to be able to do that too. One other thing that I'm exploring right now is how these platforms can offer us an opportunity to offer staff care. Currently, I'm speaking to you from my office here in the hospital. I'm still coming in every day on my normal schedule. I hope that I'm still considered essential staff, that remains the case indefinitely, but it may not. I know in some other hospital systems, chaplains have already been furloughed or been asked to work remotely. So in either case, staff care is going to be really huge right now and the foreseeable future. So I'm looking at ways that we can put it out to staff that on days off or at other times when they're not in the hospital, that they can reach out to chaplaincy and schedule a telehealth consult. I think this will be particularly important in that we may or may not have staff culture issues to overcome on stigmatizing reaching out for help. Talking to a chaplain or breaking down or crying or whatever the case might be. I think that telehealth can offer us an option to have privacy for staff care too. So I offer all these ideas, not at all to be an expert here. I'm figuring this out as we go, but it seems that what we're doing here is answering some of the questions that I'm seeing on these online areas, and I'm also putting this out there for feedback. If you see anything that is not going to work, or the questions that you might have about some things that I've put out here on this video, please by all means be in touch. You can reach me at kirthod, KIRTHOD, at ULH for University of Louisville Hospital.org. I'm glad to be in community with you all and in connection with you, and dare I say, even a little bit excited about some of the things that we're doing here with how long-term solutions to overcoming barriers to care and spiritual care and healthcare chaplaincy can be met by some of the things that we're building right now. So I hope this finds you well and staying well, and to be in touch. Thank you.